Hi, I'm Dr. Lisa Simpson, President and CEO of Academy Health. Welcome to our Future of HSR interview series. As Academy Health celebrates 40 years advancing health services research and health policy, I wanted to build on that history to look forward at how our field is changing and how we might align our work towards higher impact, more equitable research in the future. In this series, I'll be talking with leaders in health services research, in health policy, and innovation to reflect on where we've been and, more importantly, where we're going next. Hi, I'm Dr. Lisa Simpson, and welcome to our Future of Health Services Research interview series. Today, I am delighted to be talking to Dr. Daniel Dawes, the Executive Director of the Satcher Health Leadership Institute at the Morehouse School of Medicine. Daniel, I'm really excited about this discussion. So let's start with a focus on you. As you've been a trailblazer in health equity and the whole movement and bringing evidence to that movement. And so can you talk a little bit about the role of health services research in your work directly?
It's a great question, Lisa, and it's so wonderful to join you today. So in terms of this movement to advance health equity, it would never have been successful, especially over the last 45 years, had it not been for health services research really pushing the agenda forward, opening our eyes, pushing the boundaries of our knowledge on these really multifaceted and complex issues. So I want to start with a period in time that really propelled investments by our federal government in this arena. And that started in 1979. Around that time, you had an external group of trailblazers in their own right, David Satcher, Louis Sullivan, and others, from four historically Black institutions. This is Tuskegee, Morehouse School of Medicine, Meharry Medical College, and Charles Drew in California. And together, they developed a report showing the burden of inequities in the African American community. Because before that, the federal government had failed to really invest in that kind of research to help us understand the more subtle forms of discrimination that were taking place in our healthcare system. And so they worked collaboratively, they created this report, and lo and behold, we finally got Congress, the US Senate and the House of Representatives, to pay attention to this issue with Senator Ted Kennedy and Congressman Louis Stokes leading the way in their respective bodies of Congress. And from that effort, when we had the first Senate hearing on minority health and health disparities, it led then to additional attention, right, at the federal level, right? The Heckler Report in the early 1980s, which then led to the creation, right, of the Office of Minority Health, which then led to the first major health policy post-Reconstruction, the Disadvantaged Minority Health Improvement Act, right, in 1990, under the George H.W. Bush administration. And then 10 years later, we also then saw, because of that initial investment in 1990, which at that time had produced 600 peer-reviewed journal articles on this issue of minority health and health disparities, we then saw over the next 10 years increase attention in research, right, to this issue. And in 2000, under the leadership of David Satcher as Assistant Secretary and Surgeon General, we then saw the creation of a more comprehensive health policy, the Minority Health Disparities in Research Act, right? And that actually led to then more research. So it's amazing to see this loop that takes place between research, especially in this health equity space, and policy. After completing my studies and getting a fellowship in Congress, I then got to work with many of these trailblazers who had been fighting the good fight for health equity. In 2006, having witnessed the impact that the unequal treatment, that seminal report that was produced by leading scholars in the minority health and health disparities arena, and then having witnessed the seminal report, the President's New Freedom Commission on Mental Health report, and seeing how that led to greater investments and attention now in the mental health, in the minority health arena, it dawned on me just how powerful health services research is in influencing, in informing, and really pushing forward and aligning the resources with the greatest need. And so at that point, I got to work with additional scholars as we were developing the Affordable Care Act. We knew that this was going to be the most comprehensive and reticulated health policy ever produced in the United States that took an equity lens to it, right? In fact, we would not have achieved the 62 health equity focused provisions in that law had it not been, again, for a major health service research that was actually conducted by Thomas Leviste and Daryl Gaskin at Johns Hopkins University. That report, The Unequal Burden of Health Disparities, really helped to keep us at the table of negotiations, right? As strategies were shifting, we knew that we couldn't just make the moral argument, right? That 83,000 racial and ethnic minorities are dying each year owing to health disparities. A study that was actually conducted by David Satcher and team. So we couldn't just make the moral argument because it was being ignored at that point. We had to also make an economic and national security argument. And through that health services research, we finally got the economic impact that health inequalities were having here on the United States. And that allowed us to continue to move that agenda as negotiations continued. And as a result, like I said, we now have post-Reconstruction, after 150 years, the most comprehensive and reticulated health equity-focused policy, a major feat. And obviously, we're seeing the return on investment as a result of that research.
Thank you, Daniel. That is real. It's such a great reminder of the work, that the steady, continuous work that went into achieving that progress. And so I want you to think sort of where we are today, and what does the field of health services research need to do maybe differently, or in addition, to try to push the next generation of health equity research, the next generation of policies and systems that address, really dismantling all the root causes of inequities, whether they be racism and all its manifestations in our healthcare system and in our communities. What's next?
Well, I think what's next is we have to acknowledge that taking an equity lens to our work isn't something that's to be left to those who identify as health equity research. Health equity focused health services research is everybody's research, right? That's key. So we have to acknowledge it's not just that group of folks who have been looking at these issues of inequities, but we all need to be looking at it within our respective areas of expertise. So that's first. I think the other part of it is that we need to do a better job exposing youth of color and junior scholars to this field, right? There's so many folks who have never even heard of health services research. In my class, when I expose them, it's the first time they've ever taken a class on this, right? And then the light bulb goes off in their minds that, wait a second, this is really interesting. You're talking about an area that is quite flexible, right? That allows me to leverage my particular interests, whether it's in social services, whether it's in legal epidemiology or wherever, right? Public health, so forth. I can leverage that passion and I can work within this field to create the kind of systemic change that I seek, right? And so I think that we need to do a better job really diversifying the field, right? And that's one of the reasons why we were created at the Satcher Health Leadership Institute. And then lastly, I would just say that, from my standpoint, for those of us, and I think really this field has been one that has been a courageous field, right? But in order to continue to be even more courageous, we really need to address those upstream drivers, those root causes, the fundamental causes of these inequities. And I think it's not enough to just stop at the social determinants of health. We really need to be addressing what are those structural issues, what are those political determinants that have really instigated many of these inequities that we observe or we've been experiencing downstream. And I think once we are bold in our approach in addressing and going further upstream, right, than we have ever been, and we continue to examine what has instigated these results, I think we're going to see tremendous changes result and a greater impact from this field moving forward.